Imagine this is chromosome 9 and this is chromosome 22. On most days, they mind their own business. But in some unlucky cells, a tiny swap happens. A bit of 9 breaks off and sticks itself to chromosome 22, and a bit of 22 hops over to 9. This is called a chromosomal translocation. What we have here is the deadly BCR-ABL fusion gene, which causes chronic myeloid leukemia, also known as CML. It's like your cell has accidentally installed a piece of software that has just one instruction: divide, divide, divide. BCR-ABL promotes an unusually high activity of an enzyme called tyrosine kinase. This is responsible for rampant cell growth of immature white blood cells, a classic hallmark of cancer. Up until the early 2000s, most blood cancers were treated with aggressive interferon chemotherapy and high-risk bone marrow transplants. But then, an oncologist named Brian Drucker came along. His big idea was, what if we don't just throw chemotherapy at everything? What if we specifically target a tyrosine kinase receptor to go after CML? This was a radical idea, that specific cancers have specific molecular targets. One size fits all did not have to be the treatment paradigm anymore for cancer. Dr. Drucker worked with Novartis to identify a class of molecules that would inhibit tyrosine kinase. After the hard work of actually finding a molecule, Drucker had to still convince Novartis that this was something worth going after, something that you could push clinical trials for and bring it to market. During development, there were concerns around the toxicity of the drug, and Novartis was reluctant because they felt that patients may not survive long enough to see the benefits of this treatment. And that's where Drucker did what he had to for his patients. He was single-minded in his approach to push for clinical trials and make sure this came to market. After 3 years of clinical trials, Gleevec was born. Gleevec was hailed as a miracle drug. 98% of patients who underwent treatment saw complete hematological response. 5-year survival rates for CML patients rose from 30% to 89% after the introduction of Gleevec. This was a huge win for cancer biologists everywhere, and it ushered a new era, the search for more humane, targeted treatments for cancer. But how does a clinician even know that a patient has a BCR-ABL fusion gene? That's where genetic testing comes into play. The first step in detecting the BCR-ABL fusion gene or quantifying the fusion gene itself involves extracting high-quality, intact RNA from a sample. And that's where Cambrian's blood RNA isolation kit comes into play. Over a period of time, quantifying the expression of this fusion gene allows clinicians to make very critical decisions on the correct dose of treatment for a patient, or even when treatment can be stopped. This is a remarkable success of the history of cancer biology and completely changed how researchers thought about cancer. Today, we're very proud to say that Cambrian's blood RNA isolation kit supports this exact workflow across labs all over the country.